Dental implants are used to replace teeth. They could be used to replace one single tooth or multiple teeth. And to do that, dental implants use different types of pieces known as abutments that are screwed on top of them and allow you to place the implant on top. On the top right, you can see a straight abutment that is used to cement in one crown. One crown could be placed on top of the abutment. This is the abutment screwed into the implant, and the crown is placed on top. Each one of these parts or abutments has a shape that fits a particular use. Some of them are for crowns or angle crowns. Some of them can be for dentures, and they have clips on top. So each one of these abutments is different. What is similar to all of them is that they all have a screw that comes in through the center and tightens or holds these two parts together. So all of them will have these screws, and all of these screws have to be tightened to a specific strength to stay tight over time. So for these two pieces to stay tight and not become loose, you have to torque or tie down the screw that holds both pieces together. Now this strength of putting them both together is known as torque, and it's usually more than what you can tighten with your fingers. That's why we have specific drivers that will help you with it. It's important to understand the strength used to tighten an implant screw, because each one of the screws has a specific exact torque that needs to be used to tighten it. If the screw is not tight enough, what the result will be is either that the screw will break when it moves, when the tooth is bitten on or there's any movement, or the restoration, the crown will loosen and move and then break, or you'll get leakage of food into the implant causing an infection. So here you see a screwdriver tightening a screw and holding a crown onto an implant. If this is not tight enough, either food will get in here or something will move. Either the screw will break or the tooth will break. Now if you screw it in too tight, you can either break the screw into the implant, or there will be too much pressure on the implant and the bone. Both of them negative results that you do not want. We tighten the implant screws with dental screwdrivers. We call them implant drivers. And implant drivers come in different shapes, and on top of them we put the drivers. These come with different shapes. You can see the shape here and the star shape here, the square shape here, and a bigger star shape here. All of these are used for different types of screws. Like a slot and a Phillips, when you use them in your handyman toolkit at home, each screw has a specific type of tip that will fit it. The companies do that. They claim to make the screws stronger, but they also have patents on them so that you cannot buy any regular screws. You will have to buy expensive screws from the company. Each manufacturer will make different sizes of screws and shapes that are needed with different driver tips to fit them. If you're using the wrong tip on a implant screw, it will either not fit and not tighten it enough, or it will fit very tight and strip or ruin your screw, or it could even break your screw. So do not use the wrong driver tip with the wrong implant. Here's a list. For example, the SCS screwdriver, the big star, is used by the Straumann company. The Unigrip star, the smaller star, is used by Replace Select or Noble Biocare. The 050 is used by Astra. The 048 is used by 3i. 035 used by Ankylosis. 4 lobes, Toman. So each one has their own specific driver. Now the drivers come in different types of drivers. As we said, you can find finger drivers such as these that are just using your fingers. These are hand drivers where you use your whole hand. And these are handheld torque wrenches. This is a torque wrench. There are numbers here to wrench to a certain torque. And then there are electronic ones that do it with an electronic motor. The finger or hand screwdrivers I used to tighten the screw just with your fingers. They come in a different lengths from short, medium, and long. And of course the short is used in the posterior, and the long or the hand can be used in the front in the anterior teeth. These drivers give you the best manual feeling, so they're really good when you begin the process of tightening a screw, so that you're absolutely certain that you could feel the screw going into the slot. It's also good for a try-in. If you're going to remove the screw and you just want to lightly tighten it for a quick try-in, then these are the best for it. But remember, you cannot tighten to the required final torque because there's not enough strength in your fingers to tighten it. So you cannot use these for your final delivery of a prosthesis. Now the torque wrenches can be either mechanical like this one on top, or they can be electronic, but they can tighten to a specific torque. So they're used with latch type drivers to tighten the screw down, and they're really mandatory if you're going to do the final tightening when you deliver a prosthesis. Remember, each screw has a specific torque strength number that it needs to be tightened, so you can adjust that on the torque wrench. And for different screw angles, you start the tightening using a finger driver. So here you can see an implant that has a little angle. If you just try and use an electronic torque wrench going straight, that screw will not go in. You need to put the screw in at an angle, which is very hard with a big device, and it's much easier to start that with your finger driver. The driver we use is the Salvin Access Torque Wrench. This is our favorite torque wrench. It is very easy to use. It uses latch type drivers which are in the kit, and it can torque all the screws to the company specific torques. So all the company screws from any company can work with this. The torque number is determined by moving the dial in the back of the handle to the correct torque number. For example, here 30 Newton centimeter, 32 Newton centimeter, 35. You can design and pick the torque you need. It's really important to remember when you're done using it, every time you've got to rinse it, dry it, and oil it prior to each sterilization cycle. You can see the little hole where it says oil, and you just lightly oil it in there. What are some of the torque wrenches used and the torques used in implants? Well, remember, every system and screw have their own torque that you got to use, and you have to remember it or look at it every time. For example, for Noble Biocare, which is our favorite system, there are two. There is the 15 Newton for some of the abutments and 35 for other abutments. ITI is 15 and 35, the same as Noble Biocare. But Implant Direct will always be in the 30 to the 35, and Astra has pieces with different torques, all of them, much more complicated to remember. What are some of the torques that we use in implants? Well, we mainly use Noble Biocare type implants, and so for the multi-unit abutment or the hybrid denture, it's going to be 15 Newton centimeters. And for all of our crown and bridge abutments, they're all at the 32 Newton centimeter. Let's look at our driver kit. Again, this is a kit that you can buy at salvin.com. There are different drivers. You can see that we have in each one a short and a long. To remind you, the short is used in the posterior or short teeth, and the long is used in anterior teeth, or wherever the depth of the hole of the implant is very long. The latch drivers are the same, short and long in each type. And we also have specialty drivers. Drivers come in a finger type driver and a latch type, and the latch type will be used either with the electronic or manual torque wrench, or they can be used with a latch adapter. This adapter will fit any of these latches and will allow you to have another type of finger wrench. Finger drivers, as I said, are really good for the initial placement. If you're just starting to put the screw in, you can use them. But the latch type with a torque wrench is what you're going to use for the final delivery. The standard that is usually used is a 0.48, and this is the standard that we will use for our Noble Biocare implants and restorations from labs such as Glidewell and DDS labs. You can always use the latch adapter with any one of these to fit and make your own finger tightening device. The 050 is not used much, but it may fit a screw that has been stripped, and it may fit some of the older companies. The gold or star type is the original Noble Biocare driver, and it will also fit Noble Biocare implants and restorations from labs such as Glidewell and DDS labs. The specialty drivers such as a quad, a square, a slot, an Astra, and an ITI, these are all special drivers used with a specific system that still has a patented screw, and you'd have to use it if you're using those implants. This multi-unit driver right here is used in all of the full mouth cases when we have a bar and clip or hybrid denture, and it's used to place the multi-unit abutments. These are specific abutments for the full mouth case. Last is our Locator abutment driver kit. It's on the bottom right, and it's used with Locator clips for dentures. The driver has 3 parts: a removal tool, and an abutment seating tool, and a clip seating tool. Using the Locator tool to place or remove a clip is very easy. It does screw into one piece, but there are, as I said, 3 parts to it: the male component removal tool, the male component seating tool, and the abutment driver. This is used to place the abutment into the patient's mouth, and these 2 parts are used to remove a clip or add a clip into the denture.